Welcome to this special presentation of Investing in Psychedelics, brought to you by the Canadian Securities Exchange in partnership with CFN Media. Hi, my name's Anna Sarin. I'm Director of Listings Development with the Canadian Securities Exchange. I'm joined today here by Timothy Coe, the CEO of Entheon Biomedical. Thank you so much for joining me, Timothy.
Thank you, Anna.
So today you're joining me as a participant in our Investing in Psychedelics series that we're putting on with the CSE in partnership with CFN Media. And you are one of the companies that is joining us, where we feel very lucky to have you guys as part of our roster of professionals that are coming to market. Why don't you tell us a little bit about Entheon?
Sure. So Entheon was formed about a year ago. It followed the death of my brother, who was a longtime drug addict. I was put in charge of his care about 3 years ago when it got acutely bad, and I witnessed firsthand sort of weekly, daily visits, visiting him, I guess the shortcomings of current medical interventions for the treatment of substance use disorder. Over the course of about 2 years, he was in multiple recovery centers, psychiatric institutions, and put on a host of drugs ranging from methadone, Suboxone, antidepressants, antipsychotics, mood stabilizers, anxiolytics, as well as receiving things like electroconvulsive therapy, as well as cognitive behavioral therapy and traditional psychotherapies. And try as they might, and the sincere efforts of, by the end of it, probably 100 different mental health professionals and sort of support staff. None of it had a meaningful effect, and he was still, in response to trauma, unable to access any of that sort of internal composition. And sadly, I lost him in March of last year. So knowing that, despite the sincere efforts of the current medical community, armed with everything they have in their arsenal, there's still some shortcomings. And so having experienced psychedelics personally, very much directed towards the, reformation of trauma, I understand that they do precisely what all those different interventions try to do, which is to go to the heart of the matter. And so in the grieving process, I sort of couldn't shake this idea that there was something within psychedelics. So I reached out to some friends that have worked with me previously in sort of previous ventures in public markets, and said, hey, we've got to start digging into this. And that's what we did. Sort of very early on, we understood our shortcomings. We're good at certain things, but we understood that there are people far smarter than us that we should probably defer some of the science to. And so our advisory board is made up of people that represent the directors and heads of places like Johns Hopkins, Imperial College of London, as well as colorful characters like Dennis McKenna. And we spoke to them about, hey, knowing that there's something here, what is your ideal candidate for a psychedelic molecule to take through the regulatory process for treating people like my brother and the millions that are like him? And so, through an iterative process, we decided or landed on a DMT-based solution that we're prepared to take through clinical trials. So we have a GMP drug source for DMT. GMP is required in that it is going into humans. And we have a research partner in the Netherlands where we're going to be doing our proof of concept work, which is a combined safety and efficacy trial.
Can you explain to us what DMT means?
DMT is dimethyltryptamine, so it is a serotonin agonist, molecularly very similar to serotonin. It is a classic psychedelic, sort of in the same family of things as LSD, psilocybin. And so they bind to serotonin receptors, and serotonin receptors are responsible for, broadly, the regulation of mood. SSRIs are selective serotonin reuptake inhibitors with the intention of creating extracellular environment of serotonin. So these molecules bind to, DMT specifically binds to serotonin receptors and creates a sort of cascade of really beneficial effects such as openness, self-transcendence, and facilitating the sort of, reconciliation of trauma. Dimethyltryptamine is a massively powerful psychoactive compound. It's present in ayahuasca, which is sort of, I think, colloquially or culturally known as being a sort of cure-all for diseases of despair. So DMT is the sort of major psychoactive molecule out of that we've isolated and we're going to be using for directed purpose of treating addiction.
That's amazing. Well, I think what you guys are doing is wonderful, and You know, that's been the joy of finding out more about the sector, is how much work, you know, this research can do for people that are struggling. Especially it's timely when you say that this is coming to market now based on what the globe is going through together, and the amount of people that are suffering right now. You know, it could be of great value.
Precisely. I think what's visible in the world is, yeah, it's sort of symptomatic of sort of larger forces at play. And I think in the world of psychedelics, the language that we sort of employ does really focus on things like oppression, marginalization, deprioritization of mental health. Ultimately, these are the forces that are reflected in disorders such as depression and substance use disorder. And some of these forces are occurring sort of globally in a societal scale. And so you have different sort of expressions of that. And I think some of the social action that's taking place is symptomatic of sort of other forces at play. So yeah, we're very happy to be, I mean, not happy, but we're in a privileged position to be working with molecules that may have, on a personal level, the ability to affect pretty meaningful societal change.
And you guys are a little bit different than some of the other issuers that are, or companies that are joining us through this initiative that we're creating. Is this very specific to, or more specific to handling drug addiction?
Yes. So the realities, as we've surveyed them, are that to take any new psychoactive molecule through the regulatory process, you have to be very, I guess, consciously directed. You need to, for each indication, there have to be very specific, outcome measurements, and a lot of sort of specifics in the protocol design that make sure that in a documentable way, what you're proposing it does is verifiable. So rather than being sort of broad and saying that psychedelics are good for you, we understand that the time and cost outlays for taking one molecule for one indication through is pretty intense. So we want to be hyper-focused in terms of what we're treating. That being said, we understand that these molecules have the potential to treat a multitude of psychiatric disorders. So that is a sort of open playing field right now, and we do have intentions to pursue some of those subsequently. But for now, we do need to be quite hyper-focused.
That's amazing. And so you mentioned earlier that that you actually just finished a financing. What's your plans for the company for the next 12 months?
Yeah, so we're in the process of doing a reverse takeover. We have a candidate that we've been in discussions with. So we believe that in short time, we're going to be announcing that and then likely listing via RTO in September, October of this coming year.
That's wonderful. Well, listen, I look forward to hosting you on the 17th, and we can dive into some of this a little bit further and have a bit more of a thought leadership discussion with some of your peers. So thank you again for being a part of this, and I look forward to watching what you guys create.
Fantastic. Thank you so much, Anna.
Thank you.